At a certain clinical threshold, staying isolated stops being just a simple preference and slowly becomes a paralyzing psychological prison. This manifests as a pattern of turning down hard-earned promotions, skipping a best friend's wedding, or pushing away loved ones. These rejections occur despite the person desperately aching for the exact human connections they are systematically avoiding. This specific behavioral paradox is known as Avoidant Personality Disorder, or APVD, a condition that affects approximately 2% of the adult population. It creates a state of internal war, where the natural human need for community clashes with a paralyzing, overwhelming fear of being judged. The disorder functions as a hostile takeover of the brain, ensuring the fear of criticism always defeats the biological drive for connection. To understand why this happens, we have to look at the psychological engine powerful enough to override our most basic social instincts. The drive behind AvPD is an unshakable, deeply embedded core belief that the individual is inadequate or flawed. This belief distorts everyday reality, turning a routine social gathering or a new job assignment into a scenario where failure and severe criticism feel like a mathematical certainty. Because the brain anticipates catastrophic emotional rejection, it triggers extreme avoidance as a mandatory survival mechanism to keep the person safe. For someone with AvPD, rejecting an opportunity or a relationship is a desperate act of self-preservation against anticipated psychological harm. Avoidance creates a self-reinforcing feedback loop. Escaping a social threat provides brief relief, but confirms the outside world is dangerous. Each cycle shrinks the person's operational world, cutting ties with their support network. This leaves them starved for affection, trapped behind a thick wall. When the brain is biologically wired for community, but consistently starves itself to stay safe, the resulting vacuum of loneliness often leads to the development of comorbid depression. While others might perceive the person as aloof or fiercely independent, their internal reality is one of profound suffering and entrapment. Without an external intervention to break this cycle, the attempt to avoid rejection guarantees a life entirely devoid of acceptance. Despite how inescapable this loop feels, APVD is a highly treatable condition when diagnosed by a licensed clinician. Clinicians use cognitive behavioral therapy to help patients actively identify and dismantle the specific core beliefs that sustain their feelings of inadequacy. Treatment also incorporates the practice of gentle exposure. By navigating small, manageable social risks, the patient gathers real-world evidence that they will not be rejected, which allows them to slowly rebuild their confidence. This process systematically removes the irrational fear, so the patient can finally choose connection over isolation. The final hurdle is that seeking help requires the very vulnerability that APVP patients are wired to avoid. Secure, HIPAA-compliant telehealth provides a vital bridge, allowing patients to bypass the anxiety of a waiting room and meet a clinician from their safest environment. Coping and Healing Counseling, or CHC, offers this specialized support for Georgia residents, with a culturally competent team of over 15 licensed therapists serving all 159 counties. CHC is 100% telehealth, treating adults, couples, and teens 13 and up. Medicaid coverage means a $0 copay, and major insurances like Aetna, Cigna, BCBS, and Humana range from $10 to $40 per session. You can visit chctherapy.com or call 404-832-0102. Warm, steady tone. The ache for connection can finally be answered when the first, safest step toward healing is entirely within your control.